Hi, how are you? I got this off a girl on the cosmedi forum. She sent me through questions to ask the surgeon. I thought that was seemed kind of important, so I thought I would, and I've added a few as well on myrealself.com, I guess, review. So it's just thought I would put out there just some questions if you're not sure what to ask your surgeon. This is what they've come up with. I haven't done this list on my own. It's mainly from a lovely girl called Stephanie. So basically, what she said are some good questions, and you can decide which questions you need to know and which ones you don't. But so here we go. So things to ask your surgeon. How do I go about showering? Can I get sterile strips wet whilst showering? So the strips that are under there, is it okay if they get wet? Or I think obviously it probably is, but you can ask anyway. When do I need to start massaging? A lot of girls have said you don't start massaging straight away. You've got to, I guess, let the implant set a little bit before you massage. So you're going to need to find that information from your surgeon. Will I need to have another breast augmentation in 10 years? Will implants affect mammograms? How long to use the tape for, whether it be the sterile strip or the tape, just they have just sticky tape stuff. When can you start applying scar creams and even just creams around your breast for stretch marks, because they can happen when your bust gets big. Is it better to leave the tape on as long as possible or change it frequently? How long until the implants drop into position? How do you know when they've dropped? How long do you have to wait for a revision? So if you've gone in and, yep, they're how you want, or even if there's a problem, how long do you have to wait to go back and get bigger ones? So if you go in and they say, okay, we can fit 350 now, X amount of time, then you can come back and you can get bigger ones. So that's what that is. What are we up to? When can you start sleeping on your side or stomach? When can you wear normal bras and not just sports bras? And maybe when can you go from the post-op to wearing just the sports crops? That's my son. If you're wearing a strap, how long does it need to be worn for? The strap to hold the breast down. That's lovely, sweetheart. Sorry. He's wonderful. How long should you massage for? Like how many minutes each time, and also how long, as in, do you do it for months, 12 months, 6 months, 3 months, or do you have to do it for a couple of weeks? Should you go see an Australian surgeon at any point after returning home just to make sure everything's okay, or should you go and see your GP, etc., etc.? How long do implants last for? Does Mentor, the lifetime guarantee, that if you're using Mentor implants, most implants have a guarantee. If you're using these implants, getting them done in Thailand, is that still valid? Someone asked that in one of the forums the other day, and I thought, well, that's a good point. I think they would be covered because they're covering the product, so it doesn't matter where you get them put in. As long as you get them put in by a plastic surgeon, I'm sure that it will be covered, but you can ask that as well. How will I know when they need replacing? How will I know if capsular contracture has begun? When can I go in still water, e.g. swimming, bath? Obviously you're not going to be able to move your arms for a long time, but hey, with waterproof bandages, maybe you can go in earlier. Oh yeah, can I go swimming earlier if I wear waterproof bandages on my incisions? What is the first sign of infection, and what should I do if I think I have one? What is normal pain and what is abnormal pain? Aching and whatnot might be normal, whereas sharp pains may be abnormal, or vice versa. How long until I can go back to physical exercise? So when you can start walking again, when you can start running again, if you're quite active like I am, when you can start doing things like netball and whatnot. All the pros and cons to implant placement, profile and sizes. So you want to know, the risks if you're going bigger, if you're going smaller, and what to expect. We all go in there with an idea of what we want, and sometimes it's just not realistic to have that, to have exactly what we want. So maybe asking about what is a realistic expectation for me, my body type, and my breasts. what is going to be worthwhile for me to get in my head. You know, instead of thinking I'm going to come out with these perfect breasts that are, you know, wonderful and perky, you know, maybe that's not realistic. Maybe I'm just going to have a nice shaped breast, but they're not going to be that big because my body won't allow it or whatnot. So yeah, talk to your surgeon about that. When can I go braless? Some surgeons supposedly say you can go braless. Some say you can never go braless. Some say you can't have underwires. Yada yada. Another curiosity thing. What activities as far as tourism can I do after surgery? If you're overseas, like I'm going to be, I'm really curious about things I can do. You know, can I go in a tuk-tuk? If I can, how long do I have to wait before I can do that? Some girls have gone on these elephant treks. I just don't think I'd be comfortable doing that or risking that. Can I do day tours without compromising the implants if I feel well enough? So if I'm feeling up to it, can I go out for a whole day, or is it not wise due to maybe blood pressure or anything like that? When can I have sex again? Everyone's curious, I'm sure. So you know what? Don't be shy and ask your surgeon. It's a very normal thing for a lot of people to want to know. I seem to have noticed, and I'm not obviously shy. I'm quite happy to ask my surgeon that. Look, when can me and my husband be intimate again without risking too much movement, or, you know, gosh, hey, if you're really brave, you can ask, you know, what positions are going to be safe for my breasts? Whatever you're up for. What are the possible complications of general anesthesia and surgery? I'm sure your anaesthetist is going to explain all that to you, and the plastic surgeon will probably explain all the surgery complications, or the nurse will. But, you know, ask. You know, if you're dying to know straight away instead of waiting for them to tell you, ask. And make sure that the surgeon gives you all the time that you need. I know they do more than 1 or 2 surgeries a day, some of them, and I think some girls have said they feel really rushed in asking questions. But you know what? This is your body and this is your life, and if you take up more of his time, too bad. You know, you need to have all your questions answered, because you're actually going to be so nervous, an absolute wreck. And I don't think that's good for anyone's healing. And sitting there going, oh, I don't know about this, I don't know about that, and getting something wrong. And, you know, if you feel like your surgeon's rushing you, just kind of, you know, maybe make a point and go, oh, look, you know, I know you've got a lot of patients today, but I've just got, you know, I do have a lot of questions. You know, this is the first time I'm doing this, and I really do need to get some answers to keep me at peace. And I'm sure a surgeon's going to go, oh, look, this chick's nervous, or, you know, and maybe he'll relax a little bit too, because I know surgeons can be a little bit stuffy because they deal with people all day. I work in retail, I get sick of people too. I understand that, but I think, you know, we're putting our health and our bodies and our lives in the hands of these surgeons. So if they're not going to give you the time you need, you know, sometimes it's best to walk away and say, you know what, this isn't my time. So I'm really hoping, I've heard Dr. Narapin's really wonderful and gives you that time. But you know, if he doesn't, I don't feel comfortable, unfortunately I'll have to walk away and I won't end up getting the surgery. So fingers crossed he's good, because I'm a bit of a stick in the mud when it comes to things like that. If you're not giving me what I want, then I don't want to know about it. Not when it comes to risking my body and my health. But everything I've heard, he's wonderful, so fingers crossed. Yeah, so these are the questions from the lovely, it was Stacey. And yeah, if you have any more questions that you think would be good to ask the surgeon, I know there's about 12 people watching these videos, but if there is something that you think is a good idea, because, you know, I've not done it, I've not been there yet. If there's any questions you think are good, put it in the comments, and I'll add it to the list. So I'd like to keep everything covered. Oh, and also ask about your medications too, because I've a few girls have been given, you know, they've been given like, here's your bag of drugs, and good luck. You know, this is how you take them. It's all written on there. That's fine, but they're kind of looking at it and they're going, oh, I think this is a anti-inflammatory. I think this one's for sleeping, and you know, I'm sure they should mark it really well. But some girls said they've gotten confused. So if you're a bit unsure about medications, make sure you get him to go through all that with you. And I think it's always good to try and get as much information before you go for surgery as possible, because you don't know when you come out or when they're trying to tell you things, whether you're really going to remember it, because you've just been under general anaesthesia, and 3 days later or even 5 days later you might not be completely up to soaking in the information. So get as much as you can before, and hope that your nerves don't put your memory on the fritz, and you can, take a notepad, write it down. Take up as much time with that surgeon as you need, you know. Yes, that's basically it, my questions for my surgeon so far, and any more questions, comment them, and thank you very much.